Alrighty, so this week's topic on our advertisements are going to be about sickle cell anemia. As you all know, sickle cell anemia is basically where your red blood cells get broken down into different sizes and it changes in different ways. So if you had one red blood cell, it turns into, as it was circular, it will turn into like a sickling, like half a moon shape. So that just basically causes your blood cells to be mishappen and break down inside your body. They become sickle. The cells die early, leaving a shortage of red blood cells. So it's basically where you have a shortage of your red blood cells. As you have your white blood cells, there should be an even amount of number that works throughout your body. This can cause blood clottages or it can cause blood flow blockages. This is called your circulation. So if someone has this can cause them to have numbness, tingling, that feeling where it cuts out their circulation. They feel like they can't move or they become paler or white looking. So that means their blood flow circulation is gone. Sometimes they feel it in their fingers. All right, so that's what that is. So sickle cell anemia comes with something called acute rhabdomyolysis. This is where it's basically just a breakdown of fibers. Your fibers are breaking down of your skeletal muscular fibers. Those are breaking down, and some of that is getting into your circulation parts where it shouldn't be. That is just that acute rhabdomyolysis. That is where it comes in with sickle cell anemia together. That is what most athletes has died on, causing them because they are combined. It's the top 4 killers dealing with athletes. You have cardiovascular conditions, you have hyperthermia, which is like a heat stroke, and asthma. Those are the top 4 killers along with sickle cell anemia. So we always like to say you have some type of symptoms. If you're feeling pain in joint, chest pain, sometimes you may feel dizzy, fatigue, shortness of breath. Like I said before, pallor, which is like you're changing of color, someone looking pale. Most people always have yellow eyes and yellow skin. Those are the most 2 signs and symptoms that you probably will see in someone who has the sickle cell trait. It is more common in African Americans than it is in any other race. If you have white Americans and African American, 1 in 12 African Americans will have it, and 1 in 2,000 white Americans will have sickle cell. So any treatments you would have to do with sickle cell would be medications. You would have blood transfusions. You may have to have a bone marrow transplant. All right, so if someone who were having these problems, we would have to refer them to a hematologist, maybe a cardiologist, or your primary care physician. There is nothing wrong with having sickle cell. No one is left out with sickle cells. We recommend for any athlete in the United States or anywhere, it would be better to have a sickle cell trait status in all athletes when they have their pre-participation physical examinations. Today, there should be where all athletes, when they're going to get their PPE done, they should have a document that states, would you like to get sickle cell traits screening, or you don't have to. You don't have to get it, but we advise all athletes to get it, because if something was to happen to the athlete, it will already be on file. And any athlete who has sickle cell disease or trait, they're not disqualified from anything. They still can play. Only thing we would just know as athletic trainers, healthcare providers, any care provider, we will know to let that patient rest more. If you need a break during basketball practice, softball practice, you let them rest. You can't make them. It's like they go at their own rate. And that's a good thing. You don't have to be disqualified for anything just because you have sickle cell disease. Another thing is, there were only about 2002, there were probably 15 deaths due to athletes not being screened for sickle cell disease. This is why it's very important for athletic trainers, healthcare providers, or coaches to make sure that their players know how important it is to have a sickle cell screening. So that is going to be the rundown on sickle cell trait, sickle cell disease. That's the most information that I would provide for you guys this week.